Australia we face a very common problem for countries that are affluent, and that is that we spend more now on healthcare than ever we have. They cost
10% you were saying of GDP?
Yeah, 10% of gross domestic product now goes into health. And as a consequence of that, well, not so much that absolute amount, but the fact that it keeps going up and up and up. And economists and others who look at it say, well, you know, there's got to be some slowdown here. Well, there may have to be, but if it's simply just curtailing everything, then you've got no space to move to improve efficiency. And one of the biggest sources of inefficiency in healthcare is not that we're running hospitals with excessive luxury. Goodness gracious, anyone been to one would know that's not true. But because we don't get the right mix of the components within the hospital itself and between the hospital and the community. For example, someone with chronic heart failure may get splendid care in hospital, but not so good care in primary care setting, general practice, or the other way around. I mean, it happens both ways. And because we haven't got that linkage, someone in their 80s with 4 chronic problems, arthritis, heart disease, emphysema and diabetes, is probably going to 8 or 10 different healthcare professionals.
So you're suggesting there's lots of wastage.
One way we could improve the cost thing is through greater efficiency at what's called the allocative level. That is making sure that the components in the system are adequately funded, not one luxury and one impoverished. And that is precisely where information technology can be immensely beneficial. So I don't see IT and stuff as it's not a major cost at the moment in healthcare. We could expand that, and I think that if it went with this degree of system reform, so that we got much better linkage among the services being provided, especially with people with chronic problems, then we might see some flattening in the rate of increase of health costs.